Everybody. My name is Dr. Tom Wyatt, W-Y-A-T-T. I'm chair of emergency medicine at Hennepin Health Dr. You know, the emergency department is the front door to our entire safety net organization. And while we deal with emergencies every day, it takes a lot of planning, preparedness, exercises, drills throughout the year to deal with an event such as what we experienced yesterday. So it was really very, very helpful to us, as Dr. Robinson mentioned, to get that pre-notification of the types of the numbers and the types of injuries that we were going to experience. And that allowed us to mobilize the appropriate resources. Here at Hennepin, you know, as a level 1 trauma center, both for adults and pediatric patients, we're able to mobilize a lot of resources very quickly. Luckily, this happened during the daytime and not the evening, so it was a lot easier for us to quickly mobilize some of those resources. The amount of resources and the amount of organization it takes to assemble those teams so that we can have a team ready for a patient when they come into our emergency department, when they arrive via EMS, is very impressive. And as I stated yesterday, I'm really proud to be part of this organization and all of the different components of the teams that we had yesterday. I listed some yesterday, and I know I missed some people, so I won't try to list them all, but there's a number of different specialists that come down to help us for these types of events. After the MCI response was over, as emergency providers, we unfortunately don't get to stop what we do. We have to continue working. We have to continue to see the patients that are continuing to arrive to the emergency department. We have to continue to work the shifts that we are already there for, and that can take a toll as well. Once you try to process what you experienced in a mass casualty event such as this. So again, we received an outpouring of support from the local communities from across the nation. I've received messages and support from chairs of other emergency departments across the country. It's just it's been very meaningful to us and our teams. So thank you for that. I want to introduce Dr. John Gakin, who's one of our head trauma surgeons.